Hi everyone, welcome to week 5 of our course. This session will focus on one of the main domains related to the refugees' health, water and sanitation, or what we call it WASH, which is an acronym for water, supply, sanitation, and hygiene. In this session, we will describe the health sanitation for water among displaced population settings, and we will explore the emergency response for WASH. As well, we will identify different approaches and techniques to improve water sanitation for displaced population. During harsh weather-related circumstances, such as flooding and drought, the vulnerable population are the most prone to diseases related to water and sanitation. Thus, the provision of water and sanitation services is a crucial component of a humanitarian assistance during emergency. Due to the interconnectedness between water, sanitation, health and poverty, lack of safe water supply and proper sanitation has much wider impacts than on just health alone. Large-scale death and poor health are not only matter in its own right, but also act as a brake on economic development. UNDP stresses that clean water and proper sanitation can make or break humanitarian development. The situation worsens when poverty, poor health, and lack of hygiene are all combined together. Most of the times, children from homes that lack sanitation and proper hygiene practices miss school more frequently for health-related issues such as infectious diseases. The resulting lack of education and social development further marginalizes the children and reduces their future chances of self-improvement. This slide shows this connectivity with other domains, including education and nutrition. These, by themselves, affect health and health outcomes. According to WHO, safe water supplies, hygienic sanitation, and good water management are fundamental to global health. Almost 1/10 of the global disease burden could be prevented by increasing access to safe drinking water, improving sanitation and hygiene, and improving water management to reduce risks of waterborne infectious diseases and accidental drowning during recreation. The health and environmental impacts are evident, with waterborne diseases including dysentery, hepatitis A, leishmaniasis, and typhoid fever being the leading diseases affecting children, peaking among those aged between 0 and 4 years. After each outbreak of infectious diseases, guidelines state that disease epidemics in displaced population relies primarily on the prompt provision of adequate quantities of disinfected water, basic sanitation, community outreach, and effective case management of ill patients. Strong hygiene promotion is needed to maximize and sustain the benefits of these health interventions and promotions. However, hygiene behavior changes have persisted for years after the hygiene promotion occurred, indicates that this can be a very cost-effective health intervention. A study conducted in refugee camps in Bangladesh found that camps where sanitation facilities are implemented reported cholera rates of 1.6 cases per 1,000 people, while camps without such facilities had cholera rates that were almost 3 times greater, which is between 4 and 4.3 cases per 1,000 people. Both the planning and undertaking of comprehensive research on water, sanitation and hygiene promotion issues among refugee populations has remained a challenge. For instance, security restrictions prevent the WASH respondent team from accessing certain sites. Resources may not always be available to respond to highly increasing needs of the growing population. Measures that could be taken in normal situation widely differs when the emergency strikes, and shortness of staff would render the mission harder. Hence, these very real constraints hinder efforts by water and health professionals to systematically document and build on lessons learned in order to improve services in these areas in subsequent refugee operation. The interconnectedness and the impacts that unsafe water and inadequate sanitation have on human health and general well-being makes it absolutely necessary to deal with all these issues or concerns together. Water quality and sanitation are irrevocably intertwined. Improving water, sanitation, and hygiene has the potential to prevent at least 9.1% of the disease burden and 6.3% of all deaths globally. WHO estimates for children between the age of 0 and 14 that they put an annual global diarrheal death toll at over 1.8 million, far in excess of the toll for tuberculosis, malaria, and HIV/AIDS put together. In addition, it has been estimated that 50% of the malnutrition, the undernutrition disease burden alone is attributable to the environment, mainly as a result of incomplete of substandard water and sanitation provision. In this slide, we can see the link between the under 5 mortality compared to sanitation coverage for individual developing countries, and each point is a single country with countries in sub-Saharan Africa as red diamonds. This conceptual framework outlines the relationship between the limited resources, including funding, environment, education, technology, and inadequate use of existing resources that lead to this level of high population densities, poor health services, poor water and sanitation, insufficient food, which are by its turn lead to high rate of communicable diseases and inadequate dietary intake and poor immune response that lead to sort of malnutrition and increased morbidity and mortality. And this increasing of morbidity and mortality will affect again the resources and makes it more limited, and then going that lead to sort of vicious circle between the different elements. It's important to notice that refugees who do not have safe access to sufficient water of good quality and sanitation may adopt risky coping mechanism, and also that as water points become closer and more accessible, security risks affecting girls and women while accessing water are targeted. It's important to distinguish between two types of response. In the case of acute emergencies, response programs should be rapid and limited intervention, while the case of complex emergencies, long-term interventions should be implemented, such as planning and policy support. The sphere minimum standards for water supply, sanitation, and hygiene promotion are a practical expression of the right to access water and sanitation in a humanitarian context. The standards are grounded in the beliefs, principles, duties, and rights declared in the Humanitarian Charter. These include the right to life with dignity, the right to protection and security, and the right to receive humanitarian assistance on the basis of need. People affected by crises are more susceptible to illness and death from diseases, particularly diarrhea and infectious diseases. Such diseases are strongly related to inadequate sanitation and water supplies and poor hygiene. WASH programs aim to reduce public health risks. The WASH programs work on long-term prevention and control measures for improving health, reducing poverty, and improving socio-economic development, as well as responding to global emergencies and outbreaks of life-threatening illnesses. It's important for these programs to be in charge of the entire work chain, from the sourcing to the consumption. Also, it's important to manage the entire sanitation chain in a sort of integrated manner and to support and promote positively health behavior in addition to ensure health access to hygiene items. WASH approaches should be tailored based on the needs, culture, and the nature of the disaster. First, WASH team should start by assessing the water and sanitation needs of the affected population. Then, the staff should start providing water in different manners. Afterward, it's important to start planning and implementing hygiene promotion activities to make sure that all of the vulnerable population stay healthy. It's always important to remember that safe water supplies, hygienic sanitation, and good water management are very fundamental to the global health. I will leave you with this list of references for further reading and wish you good luck.